Hello, HealthPoint staff. This is the training department with an update on Aidet. As you know, Aidet is an acronym that stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. It's a communication tool to provide excellent customer service to our patients while decreasing their anxiety, increasing compliance, which can lead to improved clinical outcomes, increased patient and physician satisfaction. Here's the list of work that we've completed this year. In January, we completed a knowledge check to ensure we were all knowledgeable about how Aidet benefits our patients and our staff. We completed a rounding and asked you to demonstrate how to utilize Aidet with our patients. The managers began patient rounding surveys, which gathered information such as, did we introduce ourselves or explain the wait time? We focused recently on introduction and telling our patients our names. And lastly, we developed scripts that could help with providing that introduction, along with the duration if needed. For the next quarter, we'll focus on gaps based on our results, which shows duration needs a little work. As you can see from the graph, front office staff, the informed wait was 40% in February, 59% in March, and increased again to 61% in July. For nursing staff, in the same column, informed wait, we began with 49% in February, 68% in March, with a slight decrease in July, but still an increase overall. And lastly, informed wait by provider was at 28% in February, increased to 48% in March, and decreased to 38% in July. Here are a few examples of duration. Please let me know if you've been waiting for longer than 30 minutes. If the wait will be longer than 15 minutes, I'll come back and give you an update. These results should be back in 3 to 4 days. We will call you within 24 to 48 hours. This procedure should take about 10 minutes. Patients want to know how long something is going to take. This affects their perception of the care they are receiving. I know given a duration can be difficult because we don't have an exact time, but we know more than we say. If we're too vague and say just a moment or soon, we leave it to the patient to set their own expectation, and we may not be able to meet their expectation. What we can do instead is tell the patient we will update them in 20 minutes. If we think the wait will take longer, then we need to provide a second time expectation. We can take another strategy by saying something like, "You're the next patient to be seen." When we do this, we can reduce the patient's anxiety by setting a realistic expectation. When the patient is informed, they are calm, which means less use of them stepping out to check on their status or checking back with the front office, and less pacing in the exam room. Here are our next steps. The next steps are for you to watch the required Aidet video. If you're at this point, you've already completed this. Great job. We want to review results. During our next scheduled huddle, we will schedule this for next week. We want you to provide us with challenges and barriers that you may face and offer solutions. As an organization, we want to reach a goal of 70% on informed wait time. This information will be gathered mostly in the month of September, so we won't know until October if we've met our goal. And lastly, we want to share with others. If you have a great way of explaining duration to your patients, share it with your team. We want to thank you for taking the time to listen to us. Have a great day.